is what we might call the young invincible, I think. How important is Seth to the success of this healthcare law?
I think it's most important is that the healthcare law is important to Seth. And I think the video actually sums up pretty well. Here's someone who's certainly been affected by the fact that the website has some challenges, but he's motivated, he's excited, what he knows of what's there is encouraging. And I think what's really important is for folks to be patient, to go back, to try again. Things are getting better, people are starting to enroll, and I think it's important that people who haven't been able to get affordable health insurance are having options and are going to have options moving forward.
But the law does need Seth and people like him. Out of the 7 million people they're hoping to sign up, they need at least 3 to 4 million of them to be people like Seth, who otherwise are fairly healthy. They're unlikely to need a lot of healthcare services. He might take advantage of the physicals and other things, preventive that are covered there. But otherwise, he's not going to cost the system a lot of money. They need that so that folks that really do have a lot of healthcare problems and need a lot of health services, those folks can be covered and not pay too much.
But nobody's really talking about the expense of this, and that's really where it boils down to, Doctor. And that Seth may only have to pay $90-something for his coverage in a monthly premium after the subsidy, and that's if the subsidies continue to flow. I'm sure we could talk to some doctors over in Illinois about the subsidies that they're supposed to get from the state. But with that, there is out of pocket that is probably $6,350. And my question to Seth would be, can you afford not only the $93, but all the out-of-pocket expenses that you're going to face for that plan that costs $93?
Yeah, I'm finding that with talking to my patients as well. We need to go back to an old adage, there's no such thing as a free lunch. Someone has to pay for it. And so if we're going to make this program work, we need to really do the math carefully. And there's just been not that much speech in the public sector that has either been overly rosy or harshly critical. We need really informative speech. And so as I talk to my patients, I ask them the same thing. Have you really looked at all of the parameters? For instance, am I on the plan? Not all doctors or hospitals are going to accept all of these plans. Can you really keep your doctor? Have you thought about the deductibles? Do you know what services you need as a person? And then look at the plan carefully to make sure that that plan actually covers those. Or if it doesn't, are you okay with that? Are you okay with the expense that will mean for you?
So the president used the cell phone plan analogy. Do we know what we're getting? Is this getting clearer for people? You guys are all on the front lines and talking to people. Are they able to make these kind of choices like you do when you buy a cell phone plan?
No. There's too much information that has to be disseminated by an individual who is not usually used to making insurance decisions. Right now we have a system that is mostly run and guided by the employers. And one person in the employer is making the decision for how many employees work and their dependents. So employees have pretty much been shielded from that whole accountability and responsibility. So consequently, they know very little about the insurance.
They've been given their cell phones at work and they don't even pay the bill.
That is correct. So,
or they pay 3/4 of the bill.
And to make matters worse, these the plans that were in force in 2013 were somewhat understandable. Everybody's had some exposure to them on the employer side. But now they are adding so many different variations to the plans just to get to those metallic levels that are being forced upon them by the law. So you're going to see things like deductibles, separate deductibles for medical and for drugs. Well, that's very rarely do you run across that now. So that's going to be a new world for the employee to have to figure out.
So go ahead. I was going to say let's help these folks who have to buy their own cell phone. Go ahead.
Right. It is new information and people are learning it. Actually, when I bought my first cell phone plan, it was totally confusing to me. And my experience as we do education out in the community is that people really do benefit from having a person live, right there in front of them, explaining it to them, whether it's one-on-one or even in a small group. Folks seem to get it more when someone actually explains it than when they read it. So I think it is new information. People are having to learn a lot. I also think people are smart. I think we can learn these things, and I think we will learn them. And we look to Massachusetts, where I talked to someone who works there who says, 5-6 years down the road, people by and large get this. They get how it works. They understand what they're supposed to look for. And I think it is incumbent on everyone in the community to help folks learn what they need to learn as they make this first step.
But Jen, if they make a mistake, just like in Massachusetts, which everybody for some reason brings up, but if they make a mistake when they're trying to acquire their coverage, they will not have coverage for the first year. They will not be able to get it. because they didn't apply in a timely manner, or they didn't fill out the paperwork correctly, or something. And the people who we're relying on to deliver the services, these navigators, they do not have the experience necessary to understand an insurance contract. They're not even supposed to explain it, but how are they going to do with 4 weeks of training what's taken someone in my role years to understand, and it's always changing.
We have about 30 seconds. You talked about that middle ground of speech. What would you tell people in that middle ground to help answer some questions that they have? What are the number one questions? What is the number one question you're getting?
Number one question I get is can I still get health care where I normally do if I go on one of these plans? That is, and what I tell everybody right away is, it's not a trick when you finally get a chance to either get through the website or through a separate company website, and you can look at that plan directly. Do the due diligence. Look at all the things that pertain to you as an individual. Do they cover the drugs that you take? Do they cover the hospital? Does the hospital that you go to, do they take it? Does your doctor take it? Have you really mapped out how much money it will cost you if you have a normal year where you see your doctor the same number of times? If you go to the emergency room, do you understand what that's going to cost? It's not a trick. There's nothing hidden in the law per se in that sense, but it is complicated. And so people need to walk through it carefully, ask all those questions, take their time. Don't simply just sign up for something willy-nilly on a weekend because you had a moment. It's a big decision, so plan carefully.